Hi, my name's Terry Gould, and I interviewed a patient using a biosensor for his diabetes. The first question I asked the patient was, what type of diabetes do you have, type 1 or type 2? And he said he had type 2, and when I asked how long he'd been diagnosed, he said it had been about 10 years ago. When I asked him if he'd seen his diabetes get progressively harder to manage, he said, well, I've never really checked my blood sugars, but when I do, they're all over the place. And then my next question was, do you have any of the diabetes-related long-term complications? I see that, you've had a stent put in one of your coronary arteries, and he said, well, he goes, I guess that's a complication of diabetes. So I explained to him that cardiovascular complications from diabetes were like stroke, coronary artery disease, renal disease, blindness in his eyes, erectile dysfunction, and that it can even lead to amputations like in your feet and legs. And a lot of that first comes from the neuropathy that comes from the high blood sugars, and then the nerves send out pain signals, and then you finally end up with numbness in your feet, and then ulcers developed. So I explained to him all that, and then I said, so over the last 10 years, it really looks like your diabetes has progressed, and that coronary artery disease is now a major risk factor. Um, so I said, would you be interested in monitoring your blood sugars to help get better control? And he said, yeah, I really would. I just, don't know when to do it or how often to do it. So my next question was, how old is your blood glucose meter? And he said it's about 2 years old. And I said, well, and then I asked what type it was, and he said a One Touch Ultra. And I said, well, that's a good brand name one. And he said he'd been checking it about 2 or 3 times a week, but usually when a patient tells you that, I've learned that may be once every 2 weeks or so. So my next question really was, well, do you want to manage your blood sugar better, because it's going to require some work on your part. You're going to have to monitor your blood sugar more often. You're going to have to make some dietary changes, increase your activity. And he said, yeah, this has really scared him. So I explained what the average blood sugar was before meals. Before, with somebody with diabetes, it was under 130, and that when you eat, your blood sugar goes up, and that so about 1.5 to 2 hours after you eat, your blood sugar shouldn't really be over 180. So I suggested that he monitor his blood sugars at different times of the day to kind of see where he was having, big spikes at, and then that would help him target those meals previously, or it'd help the physician if he was going to be put on any insulin or oral medications to be able to adjust those better, and to keep a log of the times of the days and his meals. So this patient was really seemed to be willing to do that. So I explained to him that his last hemoglobin A1C was 9.7, and that what a hemoglobin A1C showed like an average blood sugar over the last 3 months. So, and that he should shoot to try to get between 6.5 and 7% for his hemoglobin A1C. And then my next question was that, have you ever been through an outpatient formal diabetes education program? He said no. So I explained that the American Diabetes Association really suggests that you go through a formal program at diagnosis, and then whenever there's any new complicating events such as a heart attack or stroke or something. So I asked him if he'd be willing to go through this outpatient program, and he said yeah. And I said, well, I'll make the referral for you, because really getting control of your diabetes will help to improve the quality of your life, and you can really slow it down so that diabetes is manageable and that it doesn't become managing your life. and he seemed to be really grateful for the education. And I just also explained that make sure that you get some quality control solution to check your blood glucose meter to make sure it's accurate. You can get that at the store, and you know that you should check that every like month to make sure it is giving you accurate readings. So I felt my interview with the patient went really well, and a blood glucose meter is a good example of a biosensor for patient education.